Welcome back. Glad you're watching Morning Express. Our focus now is on your health, and in studio with us is Dr. Theophilus Wangata, who is here to speak about hypothyroidism and the symptoms, how it manifests itself, and of course the treatment that one can seek for this disease. Dr. Wangata, thank you so much for joining us in studio.
Thank you, Michelle.
All right, so let's begin with hypothyroidism. I understand this is a type of thyroid disease.
Yes.
What does it mean?
Actually, there are many different types of thyroid diseases. The thyroid is a very important gland that is found on the front part of the neck. And it's found in everybody, whether baby, child, grown-up, woman or man, just below the Adam's apple. Right. And it's important for the energy regulation in the body, what we call metabolism of the body. I mean,
is this the thing that usually, traditionally, Kenyans cut? I don't know if you know about it.
Yeah,
they just ask you to open your mouth really wide and cut. Is that it?
Yes. That's not what the Kenyans cut. In fact, the thyroid gland is not, cannot be cut by anybody unless it is a surgeon. Yes. And it is, for people who have real thyroid problems, some of them have a swelling on the neck. And that swelling can be visible. It is just below the Adam's apple. Yes.
And so this is hypothyroidism. How does it manifest itself?
Okay, just before we talk about hypothyroidism, we have other thyroid problems. One of them is called goiter, which is the real traditional one that people used to know, where the neck is swollen and you have difficulty swallowing. That's goiter, where there is a visible swelling. We have what we call hyperthyroidism, which means that the thyroid produces the hormones in excess. And those excessive hormones produce a variety of symptoms. And then now we have what we call the hypothyroidism. Hypothyroidism is basically low thyroid hormones. Yes. The thyroid gland is a very critical and crucial gland in the body because it produces the thyroid hormones. Right. Yes. Right. That are in charge for the energy regulation in the body. I would more or less call it the Ministry of Energy in the body. In the body. Yes.
That's very interesting. And so in the case of hypothyroidism, when there is low hormones being produced, what kind of symptoms does one exude?
When you have low thyroid hormones, which is called hypothyroidism, the symptoms are many. First of all, it's important to note that this is more common in ladies. Yeah, because it has generally affected women over the years more than men. Almost 1 in 50 women have hypothyroid symptoms, while you can find 1 in 1,000 men having the same sort of problem. The main symptoms in women present with just feeling lazy, feeling tired, and the same symptoms happen also in men. Not being able to wake up early in the morning in good time because you just feel lousy, you're not energetic, life is not as fast as before, and many of the people have difficulty losing weight, even when they eat very little amounts of food. Right. And that weight issue cannot be sorted by exercising and or diet. Yeah, they have challenges with weight. And
I mean, it's great that you mentioned that it affects a lot of women, because a lot of Kenyan women also dealing, or not just Kenyan women, a lot of women are dealing with weight issues. But why does it affect women more than men?
Because it's a hormone, women have lots of hormones that affect their day-to-day lives and the menstrual cycle. And so there are theories that suggest because of those hormones, it's more likely to affect the women. And for that reason, it has affected women even in pregnancy. Yeah, and ladies who are hypothyroid have a challenge even getting pregnant. Right. Yeah, it's one of the symptoms. The other symptoms involve just feeling depressed, not feeling happy, thinking that life is not as good as before, losing concentration, menstrual irregularities, especially in women, and they may end up having very heavy menses or menses that are not regular.
Right.
They are irregular. The other more serious symptoms can involve cardiac conditions like high cholesterol, which can also cause other serious cardiac problems.
Right, so this does not have any physical symptoms like the goiter, the swelling of the neck, and swelling of other parts of the body?
As I mentioned earlier, actually, the swelling of the neck is part of, can be part of the symptoms of hypothyroidism, but it's not the only symptom. And for your information, Michelle, the hypothyroid patients, many of them do not have a swelling of the neck.
So it's hard to tell.
It's hard to tell, and it's because of what happens, how the body, as in how the disease comes. Actually, this disease was noticed by a Japanese called Hashimoto, the common version of it called Hashimoto's thyroiditis.
Right.
And you've heard about antibodies.
Yes.
Antibodies where the body produces certain chemicals that fight itself from within. And so people who have hypothyroidism have, many of them have certain antibodies that go and fight the thyroid gland, causing the symptoms. But it's also important to note that the goiter, the one that has a visible swelling, is mostly related to iodine deficiency.
Right.
Yeah.
And that's low intake of iodine or too much intake of iodine?
Mostly low intake of iodine. And in this country, there are certain areas where the iodine in the soil is a bit low. But the government, just like many other governments around the world, have put iodine in the salt. Actually, when you go to to buy salt, you'll see it's written iodized. Yes, just to replace the iodine that is very much needed.
That's very interesting.
Yes.
All right, but let's focus on what causes hypothyroidism in the first place.
Hypothyroidism is caused by can be caused by a variety of reasons or factors. For instance, as I've mentioned, iodine deficiency is one of the causes. Autoimmune disorders, where the body fights itself from within. And many people who have other autoimmune disorders, which include rheumatoid arthritis, systemic lupus erythematosus, or SLE, you know, the one we commonly call lupus, and other autoimmune disorders can manifest with hypothyroidism, where the body fights its own thyroid.
Right.
We also have chemicals like exposure to certain chemicals like lithium that is found in certain medicines, including antidepressant medicines. And we also have exposure to radiation. So it's advised that people should not have a lot of radiation, even X-rays and all sorts of radiation. Yeah.
Right, so, I mean, in that case, what happens in the case of, I will talk about this more later, but in the case of thyroid cancer, does that not need radiation during treatment?
Usually the treatment of thyroid cancer is surgical. Yeah.
Right.
Most of the time, the doctor just goes and removes the thyroid.
Okay.
Yeah.
All right. And we'll focus on that a bit more later.
Yeah.
But talk about the risk factors associated with hypothyroidism.
The risk factors are similar to what I've just mentioned earlier. One is just living in societies that have low iodine. Yeah.
I mean, let's focus on that a little bit. When you're talking of iodine, someone would just think of consuming a lot of salt. I mean, how else can one improve their iodine intake?
We have some supplements that have iodine, but based on what is readily available in salt and what's available in diet in general, it is by and large enough. Yeah, most of the iodized salt has put quite a good amount of it, though not as to the very best level, but it's good enough. The challenge comes in when you don't take salt. And by the way, one of the most natural sources of iodine is seafood. Yeah, so
lots of fish.
Yeah, especially from the sea. Yeah. The challenge comes in when you don't take salt because the doctor has said that don't take salt.
Right, because that was my next question. So what do you do in
if you don't take salt completely? By the way, this issue of don't take salt completely, salt is still very important in the body. Yeah, there are low sodium concentration salts available. It is best to say reduce your salt intake than say don't take salt completely. Yeah,
because that also has its own implication.
Yes, and especially so in this country where the iodine is put in the salt. Yeah, in some countries iodine has been even put in bread. Yes.
To ensure that they... But, I mean, there's also a lot of confusion now because, like you mentioned, some doctors will tell you don't take salt completely. And some will tell you when you take... But you say, you know, lack of iodine and lack of, you know, taking salt might cause hypothyroidism. But then there are those who say when you take salt, then it causes hyperthyroidism. And that is, I believe, the goiter and whatnot. Because there's that myth that when you take a lot of salt, you're going to get goiter.
When you take a lot of salt, you're not going to get goiter. Yeah, it's not one of those causes of goiter because the salt content, the iodine content in salt itself is not going to be is unlikely to be too much. Yeah, when you take a lot of salt, the challenges of high blood pressure and other conditions are the main culprits.
Not goiter.
Not goiter. Goiter has been noted in people who take iodine in excess. But mostly not through salt, yes, through other situations. Like we have certain X-rays that also can require iodine, called contrast. And if that is done repeatedly and a lot of times, you can have a situation where your thyroid gland is hypoactive.
Right.
Yes.
Right. And so how then do we treat hypothyroidism?
Hypothyroidism treatment requires, first of all, a clinical evaluation. And clinical evaluation requires the doctor to sit down with the patient, listen to the story, and more often than not, the story comes out very clearly. Oh, I'm so tired, I'm gaining a lot of weight, I'm not able to lose weight, I've been going to the gym and nothing is working out, I have all these symptoms. Then the doctor examines, and at that point, the doctor does certain tests. They are called thyroid function tests. Beyond the thyroid function tests, the doctor can also do what is known as a thyroid ultrasound scan or a neck scan. And for some cases, an FNA or fine needle aspiration to remove certain cells from the thyroid can be done. Once the diagnosis has been made, because the diagnosis can be hyperthyroidism or hypothyroidism or even cancer of the thyroid. Once the diagnosis has been made, the treatment, most of the time the treatment is with tablets.
Right.
There is a tablet called levothyroxine. And levothyroxine is quite effective. Actually, the treatment of thyroid problems is very easy once you've diagnosed it. Including thyroid cancer is one of the cancers that has got a good treatment and good response to treatment. So when you're treating thyroid, the treatment just revolves around giving the tablet every day, and it's going to be for life most of the time.
Oh, this is for life?
Yeah, it's going to be for life most of the time. Yeah.
So it's manageable, not treated?
It is manageable. Because what happens, the things that bring the thyroid problem, more often than not, continue being there for a long time. And most of the people, it's because of the autoimmune thyroiditis, where the body fights the thyroid cells. They are not able to produce enough thyroid.
Right. Right. We're speaking on the implication of the fact that it's a manageable disease. But we're speaking to Dr. Theophilus Wangata on hypothyroidism, what it is and how it can be treated. And you can call in studio and ask him any question that you want. I understand we already have Joanna calling in from Satellite. Joanna, good morning to you. What's your question to the doctor this morning?
Okay, my question is, I have those symptoms of hypothyroidism, and I wanted to inquire, where can I go to hospital so that I can get maybe the treatment or maybe get the diagnosis. And then he has said something like it can't be cured, but it can be managed.
Right.
Okay, if you go to that hospital, are you going to be given the drugs there, or are you just going to get a prescription for you to go and buy the drugs?
All right, that's Joanna. Joanna, just before I let you go, maybe I could ask you, you say you have a problem with hypothyroidism, but you haven't gone to hospital yet. How did you confirm that you had this problem?
Basically because I feel so tired. My life is not the same. I'm always so weak.
Right.
So even it's my husband which was telling me, like, there's a certain disease called hypothyroidism, and basically maybe that is what is making your life so weak and tired and lazy. Sometimes even I just wake up and I don't want to do anything. I just maybe want to sleep. But that is not me. That is like after I gave birth, that is what I started experiencing.
Right.
So I feel totally that my life has changed. Being this lazy woman who have not been.
Okay. Joanna, thank you so much for calling in. I'm sure Dr. Wangata will be addressing your concerns. Do keep calling in studio and asking us any questions that you'd like. Doctor, that's a very interesting question that has been posed there by Joanna. First of all, she ended by telling us that she just gave birth.
Yes.
And you spoke earlier on about thyroidism and pregnancy.
Yes.
Could this be what she's going through?
It is related to the fact that she was pregnant recently. And Joanne, thank you for calling. That was a very good question. The weakness, the tiredness, the laziness, unless you see the doctor and the doctor really confirms the hypothyroidism, there are many other conditions immediately after getting a baby that can cause that, including just the stress of pregnancy. But in this particular case, it is possible that she has hypothyroidism. And if she has hypothyroidism, Joanne, you need to go to your nearest clinic or hospital. The doctor will examine you, and if he suspects the condition, he will do the thyroid function tests. If the thyroid levels are low, the treatment is quite easy, actually. There's a medicine that the doctor will give you called levothyroxine, and you have to adhere to the treatment. Yeah, because then the dose has to be based on what the doctor sees on the results, not what your symptoms are. It is based on the laboratory findings of the results, not on what you feel. Yeah, and the dose has to be adjusted either upwards or downwards, depending on your on those tests. Yes.
And I mean, another concern that I wanted us to address is what you mentioned, that this is a disease that is manageable, not treatable. So does this mean that this treatment will have to, the medication rather, will have to go on for the rest of their life?
Yes, I would just say by and large, yes, because most of the time in this country, once you have hypothyroidism, you end up using medicines for a long time, even for life. Reason being, the causes, the common causes of that condition are related to an autoimmune disorder that makes your body fight the thyroid.
Right.
Yeah, and unless it's a different sort of cause, like maybe iodine deficiency, which can be corrected more easily, it's likely that you would spend most of your life on those medicines. Yeah, and then there's a category of patients who require surgery. The surgery can involve removing just part of the thyroid or removing the entire thyroid. And most surgeons in this country, actually all of them, are competent enough
to perform that surgery.
To perform that surgery. It's one of the basic surgeries for general surgeons.
Okay, all right,
yes.
all right. So that is where you can get that kind of treatment. I understand we also have Lillian calling in from Nairobi. Lillian, good morning. What's your question this morning? Lillian, if you can hear me, what's your question this morning?
Hello.
Yes, go ahead.
Okay, my question is, I was diagnosed with hypothyroidism by 2009.
Right.
And I underwent treatment for 3 years, and I stopped.
Right.
Now, I've conceived a girl last year. I feel like the symptoms have come back, and now how can I be assisted?
Okay, Lillian, thank you so much for calling in. Dr. Wangata will be addressing your concern in just a moment. And that's another very interesting question there from Lillian. Like you mentioned, this is medication that has to be taken for the better part of life. Yes. She said she took it for 3 years, then she stopped, and the symptoms are now coming back. Yes. How does she begin that? Okay, if you are correctly diagnosed with hypothyroidism, then you needed to go back to the doctor. Every so often, and it's the doctor who decides how often they want you to come back. The doctor then tells you you need to do a checkup again to see what's happening on the tests. If they are low, he will add the medicines. And the decision on how high or how low depends on the tests. Right. Yeah. So basically, Lillian, you just need to go back to the doctor. It's something that requires long-term management, and we are not going to tell you to just sit home and relax. What about the fact that she stopped taking the medication 3 years later? Does that affect in terms of resistance, perhaps, of the disease? Usually, it doesn't affect resistance of the disease. What it does, Michelle, it does just make the symptoms worse. Yeah, if you are feeling lazy when you were first diagnosed, then at this point, again, you will start feeling very lazy. A lot more lazy. Yeah, a lot more lazy. And if the levels go lower and lower, you might not even feel like waking up. You will be tired all the time. You can even go into depression and start seeking psychiatric help. There are so many psychiatric patients with depression who have an underlying hypothyroid condition. Yeah, so you just need to follow up with the doctor, ensure that unless the doctor tells you not to use the medicines, you must always use the medicines according to the prescribed dose. Right. I mean, and that being said, if it's something you have to do for the better part of your life, what is the cost of treating hypothyroidism in Kenya? It's not... the cost of the treatment, for example. The cost of the treatment, it's not that expensive compared to, say, the cost of treatment of high blood pressure or diabetes. It's a bit on the lower side of the scale, and it is manageable because the drugs are readily available. Even in the, I believe they should be available in most parts of the country. Right. Yes. Okay. Yeah. And earlier on, we had mentioned the issue of thyroid cancer, and you know, the first reaction when one hears I have a thyroid condition is, am I going to get thyroid cancer? What causes thyroid cancer? Oh, Michelle, that's a good question. Thyroid cancer, just like other cancers, have a myriad of reasons or factors that are related. One is just ionizing radiation. People who are in places or find themselves where there's lots of radiation, that can be a cause. And you can also have cancer that goes from other parts of the body into the thyroid. Like you can have cancer from the ovary that goes into the thyroid. But the primary cancer of the thyroid is mostly related to ionizing radiation, and it's not common. That's the good news. All right. Yeah, it's not common. And the other good news is it is treatable. It's one of the treatable cancers, and it's easy to manage. It's easy to manage because if you diagnosed early before it has spread or metastasized to other parts of the body, the treatment is surgical removal of the thyroid. And once you remove the thyroid, you will be on levothyroxine or the thyroid replacement for life. Right. Yes. Okay. The other good thing, the other thing to mention is there's among the risk factors, as you had asked earlier, there's a category of people who are prone to getting thyroid problems because of family history. Right, it's inherited. It's inherited, and there are some gene experts who have already singled out some genetic markers that can be checked in a lab for people who have family members who are
who have thyroid issues.
Right.
Yes.
That's very interesting.
Yeah.
All right, Doctor, let's take several more calls. I understand we have Caroline, who is calling in from Umoja. Caroline, many thanks for calling in. What's your question this morning?
My question is, my kid was diagnosed with hypothyroidism last year when she was 9 months. Then we sought medication from a doctor in Mombasa.
Right.
Then she was on medication since last year, July. Then we went for clinic again on August. She was still given medication. Then we were supposed to go back to the doctor on January so that she can be told, she can be tested whether the problem is over. Now I was asking, because I've seen that it can't be cured, it can only be controlled, even for the kids, because she was 9 months, now she's 1.5.
Right.
Is she still having the same problem, or for the baby it can be cured?
All right, Caroline, thank you so much for calling in. Dr. Wangata will be addressing your question in just a moment. We also have Gasheri, who's calling in from Mudhurwa. Gasheri, good morning. What's your question? Gasheri, if you can hear me, what's your question this morning? All right, we seem to have lost Gasheri. We'll be getting back to him in just a moment. But let's begin with the question that has been asked by Caroline. Her 9-month-old baby was diagnosed with hypothyroidism. They've gone through a string of medication, and the baby is now 1.5 years old. So her question is, does the baby still have the same problem, or does she need to continue with the medication for the rest of the baby's life?
Caroline, to answer Caroline's question, there is a condition called congenital hypothyroidism. Yeah, where a baby is born with the condition. Yeah, it's not very common, but it happens.
All right, and just before you address that, let's take Gasheri. He's now back on the line from Mudhurwa. Gasheri, good morning. I understand you've reduced the volume on your TV. What's your question this morning?
Yeah, my question is to the doctor. In 2013, I was diagnosed with the hypothyroidism. My TSH3 and 4 MTS, TSH were high.
Okay.
And then I got treatment, thyroidism tablet, 5 milligrams. I went on, I saw another doctor and told me it's not very necessary. Then I started getting a swelling in my breast. I went to another doctor, then I went for TSH once more. It was still slightly high. Then he told me I can wait and the swelling will go off. I went to a third doctor and it was still a bit high. And he told me hypothyroidism, by the way, and he told me not very necessary.
Right.
I should not even mind about the treatment. And I think I'm allergic to salt. Even very little salt is too much for me. Yeah.
All right, Gasheri, many thanks for calling in. Dr. Wangata will be addressing your concern in just a moment. But let's continue with Caroline's question, Dr. Wangata. You are talking about congenital hypothyroidism.
Yes, Michelle. The question that was raised by Caroline is about the child. And this child was diagnosed with hypothyroidism. Then later on, she seems to be out of the condition.
Right.
Most children who get born with congenital hypothyroidism end up using thyroid medications for life. Yeah, it's because of many of them are born with a problem that can only be sorted by replacement of the thyroid. But unless I have all the facts of the matter, I would not say 100% that the child will need thyroid replacement for life. It's just that most children would need that because they are born without capacity to produce the thyroid if they are born with congenital hypothyroidism.
Right.
And thyroid is essential for life, apparently. Every cell in your body requires thyroid. It's very essential for life the same way you need glucose, the same way you need oxygen. So without the thyroid, you have to replace it. Yes.
So what happens in situations when, like Caroline's, there's no symptoms right now being exhibited by the child?
I believe it could be those times when the level could be going down, but you don't notice it. And you wait until the child gets those symptoms again. That's when you go to the hospital. Yeah.
Right.
So rather than wait until you get the symptoms, keep going to the hospital. And what should happen ideally is the doctor should be the one to guide you and tell you, Caroline, bring your child again after 3 months or after 6 months or something like that.
Right, right.
Yes.
Okay. Now, before we address the next question, let's take another caller. We have Ben calling in from Machakos. Many thanks for calling in, Ben. What's your question?
Hello.
Yes, Ben, we can hear you. Go ahead.
Yes, I have a child. I have a child who has been diagnosed with meningitis a year ago.
I'm sorry?
But she's almost overcoming it. And she has been on Tegretol medicine. And reached a point, then they changed the medicine to epilene. Epilene, that's the sodium valproate.
Right.
Now she has exhibited on and off kind of such kind of disease. I don't know whether it is. She's complaining of the neck area. Then we take her to the hospital. Then she has been given some antibiotics, different antibiotics, like the glove medicine, that kind of thing.
Right.
Then it clears, then she stays for around 3 months. When she takes something like sweet, the condition comes again. Now, could it be the same problem? I just want to know.
All right.
What is it?
All right, Ben, many thanks for calling in. That question will be addressed by the doctor just in a moment. And let's take our final caller. We have Issa, who's calling in from Garissa, I believe. Issa, good morning. What's your question?
Yes.
Calling in from Mandera, rather. Issa, what's your question?
Madam, how are you?
Very well, thank you. How are you?
I'm calling from Mandera. I want to ask a doctor a few questions regarding to the on the topic, but it's out of topic.
Go ahead. Go ahead. All right, we'll be getting back to Issa as we continue with this conversation. But Doctor, let's begin with a question that was asked by Gasheri, who called in from Mudhurwa. And Gasheri's question was with regard to, he said he had hypothyroidism. He's gotten several rounds of treatment, but the swelling is still there, and he doesn't know what to do now.
Okay. That was a good question again, Gasheri. Once you have been diagnosed with hypothyroidism and then the treatment is initiated, usually the treatment is medical for those who do not have a visible swelling that is causing symptoms. You know, the swelling can be too visible until everybody is wondering what's wrong with your neck.
Right.
The swelling can also cause difficulty swallowing or even a hoarse voice. If the treatment on the medical side is not helping, then there's a surgical option where the swelling can be surgically removed.
Right.
And this is done very competently by surgeons. Of course, it also has its complications, like the voice might go for a short period and then you regain your voice.
Oh, so it will come back, though.
The nerve that controls, the nerve that controls the voice is close to the thyroid gland. So surgeons are also well trained to ensure that that nerve is not affected while during the surgery. But it's a very, as I've said earlier, it's one of the surgeries that is performed routinely in many hospitals across the country.
All right,
Yes.
so Gashari, that could be your solution, having the swelling surgically removed. And then finally, we also had a question from Ben, who was calling in from Machakos. Ben says he has a child who had meningitis.
Yes.
And then she's gone through several rounds of treatment, but now she's complaining and exhibiting symptoms that are similar to hypothyroidism. She's complaining a lot about her neck and about fatigue. And so he's asking, could this be hypothyroidism?
Ben talked about meningitis at the beginning and also talked about being put on medications that are related to medicines for convulsive disorders like epilim and tegretol. I believe this is mostly related to the neurological system, that is the brain, and not related to the thyroid. Your neurologist, I'm sure the person who prescribed the epilim and tegretol understood the meningitis and the effects, because meningitis can easily cause epilepsy, or convulsive disorders. Unless we do the thyroid, I don't think those are symptoms of thyroid. And
so even the neck, the discomfort on her neck?
Usually meningitis presents with neck pain, and neck stiffness is one of the cardinal symptoms of meningitis.
Right.
Yes. In fact, in children, we check the neck if it is stiff. Did he say the age of the child?
No, I believe he did not say the age of the child.
Yeah. We check if the neck is stiff, and we also do check other symptoms, but the main symptom, one of the main symptoms we check is the stiffness of the neck. Did he also talk about swelling? I didn't hear that bit.
No, yes. He talked about, I think, swelling of the neck,
Okay. If there is a visible swelling of the neck, then the child needs to be checked also. In that particular context, maybe the child has two sets of problems going on. But the meningitis and the epilim and the other treatment are squarely related to the neurological symptoms. If the child had meningitis, then it is important to put the child on that treatment.
All right.
Yes.
All right. Thank you so much for speaking to us. Dr. Theophilus Wangata here, speaking on hypothyroidism, how it affects people, what symptoms it exhibits, and of course how it can be treated. We thank you at home for also calling in and giving us your comments on Twitter as well. And this conversation brings us to a close here on Morning Express. So thank you for watching. My name is Michelle Ngele. Do join me tomorrow, same time and same place. For now, I'll be back at the top of the hour with Worldview.